to ask you a question.
Yeah.
I'm feeling a little, confused, overwhelmed, with being diagnosed with type 1 diabetes. And I just, there's just so much information to take in, to learn, and I'm just so overwhelmed that there's different types of medication. I have to take it at certain times, like before or after or during my meals. I don't even know. I got to watch out for there's signs of if I haven't had enough insulin, or I haven't eaten, or if I've eaten too much and didn't take my insulin. And then there's hypo and hyperglycemia, which I'm not sure which one is good or which one's bad, or if they're both bad. So it's just a lot of information.
There is.
So I really wanted to ask if I could stay with you for maybe 3 or 4 days, maybe even longer.
Absolutely.
Just so you could sort of help me out with all this.
Oh my gosh, absolutely, dear. Come on over. Bring all your stuff. You can stay in the guest room.
Okay.
And we'll work through this together.
Great. Thank you so much.
Absolutely.
I really appreciate that.
Absolutely.
Good morning.
Hey, good morning. How are you?
I'm doing well. How are you?
Pretty good.
Good.
Pretty good.
My name's Blaine. I'm going to be the nurse taking care of you this shift, okay?
Okay, hi, Blaine.
And you are?
My name is Rusty Zoreb.
Okay. And your date of birth?
It's November 6th, 1989.
Okay, great.
And you are?
I'm Mrs. Zoreb. I'm Rusty's mother, and he's going to be staying with me for a few days after he's discharged from the hospital.
Okay.
Just, so that we can work together to kind of figure this whole thing out.
Sure. Great. So, Rusty, you're okay with your mom being here while we talk about things
absolutely.
today?
Yeah, I want her here.
Great.
Absolutely. Thank
and
you.
how are you feeling today?
I'm feeling much better than the other day.
Okay.
But there's just so much information to learn.
Mm-hmm.
I want to be able to deal with having diabetes.
Yeah.
But there's a million details to remember.
There are.
And I just feel overwhelmed.
There
right
is.
now.
There's a lot to learn. We're going to be going over a little bit of information this morning, so it'll be helpful to have Mom here so she can kind of listen in
Right.
too. But right now, I'm just going to go ahead and get your blood sugar checked, okay, to see if you need any insulin before breakfast.
Wait, again?
Again, while we're in the hospital, there's a lot that can alter that blood sugar, okay? So we just want to make sure that we're giving you the proper amount.
I feel like I'm getting stabbed all the time in my finger.
I know.
Is it going to be like this forever? Or?
Yeah, it is. It's kind of confusing because it
Sure.
seems like, he's doing it all the time. So
Sure.
why do we have to do this
Well,
so much?
right now we're just trying to get everything regulated.
Okay.
So kind of what's going on in your body. So when you eat, the foods that you're consuming are giving your body the energy, the blood sugar that it needs to make everything work properly.
Right.
So with type 1 diabetes, your body is not producing any insulin at all. So we have to
Oh,
give it
wow.
artificially to kind of push that sugar, that energy into the cells to fuel your body correctly.
Oh, I see.
Okay.
So that's
That
why I
makes
take
sense?
it when I eat, right?
Right.
Okay. Well, that
Right.
makes sense.
Okay.
And that's
Yeah.
why we want to
And
make
you have
sure.
to know what it is in order for you to give me a certain amount of insulin?
Right.
Okay.
And so the whole goal
Okay.
of this is we're going to try and get your meals to correspond with the insulin so that you kind of are on a schedule and it won't alter very much.
Okay.
Does that make
okay.
sense?
Okay.
Okay, well, and once he's discharged, will we have to be on a similar schedule?
For the most part, like I said, we try and regulate that. So as long as your meals are kind of consistent, carbohydrates kind of affect that a lot.
Okay.
We're going to monitor your diet, kind of keep it consistent. Consistency is key with diabetes.
Okay, so
Okay, and then that
sure.
insulin should be kept pretty consistent too. And they'll give you key tips, if you can't eat at a certain time, what's going to happen with your blood sugar and the rises and falls and things like
Good.
that.
Good.
All right.
Great.
Okay.
Great. Thanks.
All
Thank
right.
you, nurse.
So let me just go ahead and get your armband scanned here.
Okay.
I'm going to go over this in step-by-step detail, so if you kind of want to watch closely so you
Okay.
can see how it's done,
Absolutely.
that would be beneficial, okay?
Yeah, I'm gonna stay with her for a few days so
That's,
she can.
that's probably a very good thing, too.
Yeah.
Let me get some gloves on here. Excuse me for
Mhm.
a second. Always make sure before you start anything, because you are drawing blood, make sure you do wash your hands before.
Okay.
I'm putting on gloves, but I did wash my hands too as I came
Okay.
in. Got an alcohol swab here. Always make sure you're cleaning the pad of the finger before you do anything also, okay? It's
Okay.
gonna prevent
I
infection.
use the same finger every single time.
You can actually change it up because
Okay.
those fingers might get a little bit sore because they do get
Oh, I see.
pretty
I see.
frequently.
Okay.
But basically what you're going to do is you're going to take one of the kind of lateral sides of the finger here.
Mhm.
Just go ahead and clean the entire fingertip,
Okay.
okay? And before you even stick, just go ahead and start. If you put your hand down a little bit, gravity will
Okay.
kind of draw that blood up. See how it's getting red when I push it up like that?
It is red.
Okay? It means the blood's getting there and you'll get a good sample
Okay.
that way. Okay?
So that facilitates more blood coming out when you
Mhm.
stab me with the thing.
Yep.
Okay.
Because they're at the tips of your, kind of at your
Gotcha,
body, so your
gotcha.
blood's not
I
really.
see. I see.
Okay, so you pull that up, do a good massage there. Take this little sticky thing, okay?
Is this gonna hurt? What was that again?
It shouldn't be too bad, just
Okay.
a little prick, okay?
All right.
Ready? 1,
Yeah.
2, 3.
Ouch!
Not too bad.
No, not too bad.
Okay.
Just
We'll take this little strip here and get a
Mhm.
good sample of blood.
okay.
Okay, see how it filled up there?
I do.
Oh,
You fill up
alright.
the whole thing. I see.
That's
Okay.
right.
Okay.
Okay, then you'll stick it in this
Mhm.
machine. Okay,
Okay.
you'll do the sample in, just like that.
Okay.
Okay,
All right.
see that?
Yeah. Yeah, that's
Oh,
pretty cool.
okay.
Okay, and then it'll take a couple seconds to kind of read.
Okay.
You can take a little bit of gauze and just kind of, you're not bleeding too much. But
No, it actually stopped
Yeah.
bleeding pretty much.
Yeah,
but,
you can cover some
Okay.
gauze with that for a
Okay.
couple seconds to stop the bleeding.
Okay.
Okay. So I see here that your blood sugar is 190.
oh,
the reading
yeah,
right
okay,
there,
I see it.
okay?
I see it.
All right. So I'm just going to make note of that in the computer over here.
Okay.
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 That's a good reading?
Actually, 70 to 110 is a good reading. That's
Oh.
kind of your
Okay.
normal golden range there.
Okay.
So 190 will require a little bit of insulin.
Okay.
Just going to make a quick note of that on this computer here.
Okay. So I guess it's a high reading for me.
Yeah.
then.
Yeah.
All right. And I'm going to run out and grab your insulin and your breakfast tray, okay? Since they're supposed to be given together.
Oh, great!
Okay.
Because I'm absolutely starving.
I
right
bet.
now.
Yeah, first thing in the morning, I'm starving too.
Yeah.
All right. Anything else you need while I'm out?
Just the breakfast.
Okay, good enough. Be back
Thanks.
in a couple minutes, okay?
Thanks.
Thank you.
Hello again.
Oh, hey.
I'm back.
Good. Because I am starving.
I know. I see your breakfast tray beat me here, huh?
Yes.
All right. Well, we'll try and make this as quick as possible.
Okay.
And we'll just get that food right in your system, okay?
Great.
Okay.
Great.
Go ahead and state your name and date of birth again for me.
Okay, it's Rusty Zoreb,
Okay?
and it's November 6th, 1989.
Okay.
So we did it before. We do it every time.
Every time,
Okay,
make sure we're
okay.
giving the right meds
Okay.
to the right patient,
Okay.
okay? It's very important around here. All right. Let me just check the doc's orders here.
Okay.
So your blood sugar this morning we got just a couple minutes ago was 190, right?
Right. Yes.
Okay.
Yes.
So according to the doc, we'll be giving 4 units of insulin today based on that reading of 190.
Oh, okay. Did you call him or?
No, so he does he has composed a sliding scale, which basically means if your blood sugar falls within a certain range that he's already, preconceived, you will be given a certain amount of insulin based on that range.
I
Oh,
see. I
okay.
see.
Okay, so it can vary. So if
Okay.
your reading this morning was super high at like 270,
it'd be
obviously
another-
we'd be giving you a little bit more to
Okay.
bring it back down.
I
Okay.
see,
that make
I see.
sense?
And I'll have that same deal at home, I guess, in order to know how much insulin to give myself.
Mm-hmm.
Okay.
Okay, that makes sense.
Okay,
Okay.
got it? All right, so what I have here is the insulin pen.
Oh wow, that
okay?
looks like a magic marker.
Yeah, it does.
Interesting.
So basically what you'll see here is there's a little dial on this side here, okay? And that's where you're going to adjust yourself how much insulin to give. So each click is 1 unit. So
Oh,
I said
okay.
4
okay.
units earlier based on that 190
Oh, well, that's
reading.
easy.
Mm-hmm.
Oh wow.
Yep. So you just do 1, 2, 3, 4.
Okay.
Okay?
Okay. So because it's 190. Okay.
Yep, because
Right.
it's 190.
And if it was
you can
higher,
always,
I would click it up higher. I
Mhm.
see. Okay.
And you can always, if you mess up, if you go too far, you can back it down.
Okay.
Okay?
Okay.
So nothing's totally set in stone until you actually push this button here.
Okay.
Okay?
I use this one time. Or I
You can use the pen each time. If you see here, there's no needle on there yet.
Oh,
Oh,
there's
okay.
insulin in there.
There is.
Oh wow.
There is.
Interesting.
Okay.
Okay.
Actually, is that Nurse Betty? Could you come in here for a quick second?
Hi there, Rusty. How are you? Mrs.
Oh,
Zorro?
hello.
Hi,
Good to see
how
you
are
again.
you?
y'all again.
Yes.
I was taking care of you yesterday.
Yes,
wasn't
you were.
I?
Yes.
Uh-huh.
Yes.
Yeah, that's right.
So we're getting ready to give insulin here.
Oh, okay.
Okay.
All right. Let's see. That says Rusty Zoreb, November 6, 1989. Okay.
That's it. That's me.
All right. Let's see what your order is here. Okay. The sliding scale was
Sliding scale.
190, so you're supposed to have 4 units. Let's have a
Can you
look
tell me
here.
what I have there?
Okay, you got 4 units.
Cool.
All right.
All
Great.
well, right?
Great
All right.
to see you all
Thank
again.
you.
Good to see
Thanks,
you.
Nurse Betty.
Bye.
So she had to double check with you.
Yep, because
double-
insulin's a big thing here that we take very seriously. So we just have to make sure that you know
Okay.
everything is correct and according to what the doc has prescribed.
So the dosing is that important?
Absolutely.
Okay.
Yep.
Okay.
Because did the doc talk to you about hypoglycemia yet? Briefly.
I've heard that word before.
Mhm.
Definitely.
Yeah.
Do I know
Okay.
what that word means?
No.
Not so much.
All right. So hypo means less than, lower.
Okay.
Glycemia comes from that blood sugar.
Okay,
Glyce
okay,
is blood
okay.
sugar. Okay. So what happens with insulin? That's why we always give it with food. When you give this insulin, it takes all the sugar that's in that blood and it drives it into the cell. Remember what we were
Okay.
talking about
Okay.
earlier?
Right.
Yeah.
Right.
So if you are giving this insulin with no blood sugar, it causes that blood sugar to bottom out. Okay. So the food
Okay.
kind of counteracts what's going on with the insulin to keep everything
I
in check.
see. I
Does
see.
that make sense? So you're giving your
I
body the
see.
energy it needs without causing any type of side effect.
I see. So you
Does that
take
make
it.
sense?
So you take it with the meals.
Absolutely.
And if I like missed a meal and I took it, then my blood sugar would drop and I'd be hypoglycemic.
Correct.
Is that right?
Oh.
And then you get
okay.
all kinds of kind of scary side effects, shaky,
Okay.
Right.
Okay.
confusion, that kind of
Okay.
thing.
Okay.
So we
Okay.
always
So
want to
it's-
try
I
and
should
prevent
watch
that.
out for those kind of side effects.
Absolutely, and that's one thing that you should be aware of too, Mom,
Okay.
because it can be a little bit scary for him. Just kind of take note of those symptoms.
Okay.
Got
okay,
it?
Yeah. We'll make sure to
Cool.
identify that.
Yeah.
So
Okay.
you'll know.
Okay,
Great.
so injections are always given in the abdomen. Okay, that always that provides the fastest absorption.
Okay.
Okay, so you can kind of rotate sides just like you do with the finger stick.
Okay.
Okay.
So
So,
you
so
kinda
you don't put it in the
prevent-
same spot every time.
Mhm. Nope. And so what's unique to this is I'll show you how to do it,
Okay.
obviously, but you're going to put it in, and when you press down on this little button
Mhm.
here, that's going to inject the insulin, and you're going to leave this in place for 10 seconds.
Oh. Okay.
Okay, that allows all
Okay.
that insulin to be absorbed.
Okay.
I see.
Got
I
it?
see. Yeah. It seems pretty straightforward.
Yeah. Yeah.
It's not
does.
too
Yeah,
bad. So
yeah.
I'm going to demonstrate. Mom, you can watch as well, so
Okay.
you can start to learn how to do
Okay.
it yourself.
Okay.
Now, okay. So this is gonna go in my abdomen.
Mhm.
Okay.
Yep.
That's probably gonna hurt pretty
Yeah.
bad.
I don't know.
Like the finger stick, you'll get used to it.
Oh, okay.
Okay?
All right.
And then you can eat, so you won't
Okay.
think too much about it
you
after
need
that.
to squeeze a finger.
Okay.
You're gonna go
Yeah. Let's
ahead
go.
with
Let's
your-
go ahead and
All
do
right.
that.
All right.
All right.
Cool. All right, let me just get all the IDs and stuff scanned. All right. Go ahead and scan that.
Mhm.
Okay, and then I'll scan mine so
Okay.
they know that I'm giving it to you.
Okay.
Okay. Go ahead and get my gloves on here.
Mhm. So I'll be doing this at home myself, right?
Yeah.
I don't have to have her do it. I can do it myself.
Mhm.
Okay.
Yep, that's another perk about it being in the stomach is that you have
Oh,
both
okay.
hands free, so you can do it yourself. The pen is really simple. It sounds complicated.
So I can just
Not
reuse
too
that
bad.
pen again and again and
Yeah,
again.
the needle gets changed every time. Okay, so
Okay.
you got to make sure to discard of that
Oh, okay,
properly. It is a
okay.
needle, so
Okay.
be careful
Okay.
you don't get stuck with it. Okay.
Okay.
Again, just like the finger stick, you're going to always want to clean the site. Okay. So if you want to go ahead and get that stomach lifted up a little bit for me.
Is that good
Beautiful.
there?
That's
okay.
perfect. Yeah. Then you'll clean
Mhm.
always a larger area than you intend to stick.
Okay. And that, that gets rid of like bacteria and
Yep.
stuff.
Yep.
Okay.
Yep. Always trying to prevent infections.
Okay.
Okay. You can pull this cap off.
Okay.
Keep the cap. You can reuse it.
Okay.
Same thing. You're going to clean the tip of this, okay?
Oh,
because you're reusing
okay.
it gets exposed to the
Okay.
air
Okay,
and
so-
therefore
so my-
bacteria.
Clean my abdomen and
Mhm.
then clean the
Yep.
tip of that. Okay.
Yep.
Okay.
And because each time this needle is brand new, see it tells you right here it's sterile. Okay,
Oh,
so
okay.
unless you touch this, you don't have to necessarily clean this.
I see. And so
Okay.
that's the one that you put on
This
every
screws
time.
on here.
Right, and you throw
Mhm,
that out when you're done.
when you're done. Yep. So
Okay.
this just screws in like this.
Oh,
Okay,
okay.
screw in
Now-
until it won't go any further.
Okay.
Oh,
Got
that's
it?
Nifty. Okay.
This cap will come off.
Mhm.
Okay, so you can get rid of that. And then this is always protected. Always be
Okay.
careful to stick yourself because you are dealing with needles, but it is kind of has some safety measures attached to it.
Okay.
Okay.
needle off.
Okay.
Okay, this just unscrews like this.
And that goes.
In the sharps, you always want to dispose of it
Okay,
in the sharps
okay.
container.
Okay.
Okay.
Okay, and then you put the cap right back on,
Okay.
and that can stay with
okay.
you.
And we're done with my belly here.
That's exactly
Okay.
right. No blood there.
No, there's not.
Okay, but we'll actually just apply a little bit of gauze just
Oh,
to
okay,
make sure
okay.
that you don't have any bleeding. Okay, so you can
Mhm.
just hold that on there
Okay. Sounds
just
good.
a little bit. Okay,
Sounds good.
Okay.
very good.
Right.
What questions do we have? Anything?
That was pretty easy.
Not too bad,
actually.
right?
I think I'd like to give myself the injection next time. Is that
Absolutely,
okay? Just
absolutely.
So I can sort of show you that I know how to do it, and you can correct me if I'm doing it
For
incorrectly.
sure, and Mom can watch too. That way
Yeah.
we've got two eyes on
Okay.
you.
Okay. Good. Good.
Cool. Let me just make note of what
Okay.
we did. Okay. All right, and then time for breakfast. The best
Oh,
part of the
excellent,
day.
excellent. What do we
Got
have
some
here?
eggs, toast, cottage cheese.
Oh, cottage cheese, very, very high in
Yep.
protein.
Very diabetes friendly. Okay.
Okay.
All
Thank
right.
you so
enjoy.
much.
You're
You've
welcome.
been so helpful.
Yeah, that cottage cheese looks good.
Looks delicious.
Yes, it does.
All right, Rusty. You enjoy. I'll be back to talk to you in just a couple minutes. Okay.
Thank you, Nurse Blaine.
You're welcome.